So basically that, we're going to be talking about colon cancer. So I want to focus on the two themes. One is the prevention, and then another thing is the detecting the cancer, colon cancer early, and then try to improve the overall survival. So what is colon cancer? Colon cancer is the third most common cancer. Lifetime risk for everybody is about 4 out of 100 people will get colon cancer on average. So lifetime risk is about 4%. But some people will have higher risk of colon cancer, such as people with the genetic or germline mutation that leads to the colon cancer, such as familial polyposis or Lynch syndrome. So for those persons belong to those family carrying those genetic mutation, their risk can be dramatically higher and then multiple folds higher. So the colon cancer related to the genetic mutation occurred overall 20% of the overall colon cancer patients. And then so the other 70% of the colon cancer patients are not genetically related. The other 10% is somewhere in between. We don't have that genetic mutation linked to them, or we cannot identify them, at least for the time being. But at the same time, they runs in the family. So we know that there is some genetic link, but we don't have the particular gene that identify yet. So basically, 30% of the colon cancer patients are related to genetics, and 70% are unrelated to genetics. And who are the people going to have a higher risk of the colon cancer if they are not genetically linked? So those patients are with the underlying disease like ulcerative colitis or Crohn's disease. So for them, their lifetime risk is 18% instead of the 4% for the average people. And then the cystic patients with cystic fibrosis would also have a higher colon cancer risk. For them, it's 11 times more, so 44% chance of their lifetime risk. The other risk is radiation exposure. Depend on the radiation doses. The higher the radiation exposure, the higher the chances of having the colon cancer. So now, after going through, those are disease related, and then, we cannot much modify or reduce the risk. And the rest of the other colon cancer risk I'm going to talk about now are going to be something that we can improve or modify. For example, diet, activity. So obesity in general is known to increase colon cancer by 23%. And then diabetes can increase colon cancer by 40%. And then eating the processed meat, so 50 grams of the processed meat a day, so which is really not much. It's only the 1/8 of a pound of processed meat a day. If we regularly eat, colon cancer risk increased by 16%. And if it is a 1/4 pound of the red meat, then colon cancer increased by 12%. And smoking can increase colon cancer as much as 25%. And alcohol, heavy drinking alcohol, that is about 4 or more drinks a day, can increase colon cancer up to 80%. So basically, diet is really important colon cancer risk too. So this is a slide I really like to show, but I'm going to describe as much as I can. So right now in the United States, we are detecting colon cancer at the late stage. So about the 1/3 of the colon cancer found at the time of the diagnosis, they're already at the late stage. What is the late stage mean is the cancer already spread to the other organs already, and maybe distant organs. So we try to divide it local, regional, and advanced. So in the United States, it's split about 1/3. 1/3 is local, 1/3 is regional, 1/3 is advanced by the time of the diagnosis. So we are not detecting the early colon cancer stages, and then by the time we diagnose a patient, 1/3 of them are already at the late stage. And I will, tell you a little bit later why it is important. So I looked at a number here in SLO County, and we do detect up to about 50% of the colon cancer at the early local stage. But at the late stage, we're still detecting 30% like the national data. And then we are detecting less regional stage. So all in all, we're still detecting at the late stage in the SLO County. So why is that important for the local stage, regional stage, and the distant or advanced stage is that if we find at the local stage, the colon cancer can be cured up to 90%, 90%. But if it is diagnosed at the regional stage, then the suddenly colon cancer can be cured only at about 70% stage. But once it is advanced stage or distant metastasis are already there, colon cancer survival for 5 years decreased to 10% or below. So detecting the colon cancer at the early stage makes the dramatic improvement in the 5-year survival or the chance of the cure. So now, what can we do to prevent colon cancer and to improve the chances of surviving the colon cancer after diagnosis? So I'm going to divide it into the two parts. One is the prevention. Basically, that is preventing from colon cancer occurring, reducing the risk of the colon cancer. So what is that? Is the physical activity. Physical activity can reduce the colon cancer by 20% if someone is doing activity like walking at the speed of 3 to 4 miles per hour, about 1 hour a week. So basically, walking exercise at the brisk pace, 3 to 4 miles per hour pace, doing like 20 minutes 3 times a week can decrease the colon cancer by 20%. And if we're going to be changing our diet to vegetarian diet, or even better, pesco-vegetarian diet, which is that, fish and vegetable, and that is significantly decrease the colon cancer risk by 25%, 30%. And then here is another interesting thing is the diet high in calcium, rich in calcium. So total calcium intake of 1,200 milligram or higher daily decrease the colon cancer risk by 20% over diet low in the calcium intake daily. So with all of that, we can reduce the colon cancer from occurring. So now let's go to another level of prevention. We call it secondary prevention. In that case, we are not preventing the colon cancer from occurring from the first place, but trying to prevent colon cancer from killing us. So we call that as the secondary prevention. So in that, we have very effective screening. The gold standard, most effective screening that everybody that we know is the colonoscopy. So we call it a direct visualization technique. That means that we are looking for the colon cancer and then removing at the early stage. So in that category, we have two the procedures that we can utilize. One is the colonoscopy, and one is the colonoscopy with a CT scan. So the most effective one is the colonoscopy. And then the reason is that it can find the precancerous lesion or early stage colon cancer by 94%. So if someone is doing the colonoscopy as being recommended now, colon cancer can be prevented, or if early colon cancer is found by removing it, the chance of surviving 5 years or longer or cure is 94%. On the other hand, CT colonoscopy can find colon cancer reliably, about 89%. So if someone who doesn't want to do colonoscopy or CT colonoscopy can still consider another effective preventive method, which is on the TV, we might have seen it, called Cologuard. What is Cologuard is getting the stool sample, and then they'll be looking for the DNA shedded by the adenoma polyp or cancer of the colon. In the stool sample, they can find it. When they find it, then the person with a positive result can go on and have the colonoscopy, found the colon cancer, remove with a colonoscopy if it is small, or if it is big, doing the surgery, and then it can get cured. So with that test, can find with a 93% reliability for the cancer, and then 43% reliability for the precancerous polyps or adenomas. So still very effective, a little bit less effective than colonoscopy, but still very effective. The difference is a colonoscopy find both cancerous lesion and also precancerous lesion. So with the Cologuard, it is more reliable to find at the cancer, early stage of the cancer, rather than the precancerous stage. So they find cancer 93% chance, and then precancerous polyps 43% chance. So the least effective method of finding colon cancer early is finding the elements of blood in the stool. So with that, we can only find 50 to 74%. Then they cannot detect the polyps or adenoma. Those are precancerous stage. They only detect when cancer's already developed, and then bleeding from the cancer is detected by these tests. So nonetheless, I want to emphasize and summarize this again. By colonoscopy, precancerous lesion or early stage cancer lesion can be found with a 94% reliability. With the DNA in the stool related to the cancer can be found 93% reliable, with a 93% reliability. And for the precancer polyps, 43% reliability. With the regular stool testing, looking for the elements of the blood, can only detect cancer. They could not detect the polyps or adenoma, and they can detect with a 50 to 75% reliability. So the take-home message I want to give to everybody who patiently tolerating me, my lack of technical ability to get the slide showing, is that change in the diet and lifestyle can reduce the colon cancer risk. So by changing the diet can decrease the colon cancer risk by about 20%. And then changing the lifestyle, which is that walking just 20 minutes, 3 times a week, at the pace of 3 to 4 miles per hour, can decrease the colon cancer by about 22% too. So, but if somebody doing all of that and then unfortunate to have colon cancer, doing the colonoscopy, they can find up to 94% chance at this stage that is 90% curable. So basically, by doing all of that, we can reduce the colon cancer risk, or we can reduce the death related to colon cancer well above 90% of the time. So right now, if you remember this, the data that I was talking about, up to 60% of the patients are diagnosed at the later stage where they can only be cured by 70% of the chance, or at the very last advanced stage, less than 10% of the chance. So by doing the change in the diet, exercise, and doing the colonoscopy as recommended can decrease the colon cancer by dying from the colon cancer by 90% or higher. So with that, I will conclude my talk and then answer your questions.
Great. Thank you so much, Dr. So. Since I made you the host, I'm going to go ahead and have you stop the recording. If you just hover on the bottom of the Zoom screen.
Okay.
You should be able to